It's really shocking. As a 20, I think I was 23 or 24. I went to, I was feeling down. I had just started working for Accenture at the time, and it wasn't like a deep depression, but I just felt like I was lethargic or dragging.
Yeah.
And I went, I'm getting my annual physical, and they prescribed Zoloft to me. Zoloft for me.
Yeah.
I mean, by the way, the guy met me for like 4 minutes.
Yeah.
All right, try some Zoloft. So I, get this medication, and I don't know if we had, the internet had just started, but it was more like through AOL, so it was slow. There wasn't
Now
like,
you're aging
right.
yourself.
I mean, yeah, it's crazy.
We're pre-internet,
26
pre-cell
years ago,
phones, guys.
like 4 years into the internet, or however many years
Yeah.
it was. But, you did a little research, and then, and I haven't, believe it or not, I actually read there's a little document that comes with all medications, right?
Yeah.
And it said that it could impact libido. And, there were a lot of other negative side effects. And when I thought about that, like, okay, I'm getting a medication that may decrease my libido. And if my libido is decreased, I think I'll be more depressed.
Yeah. All right.
And I literally, like, throughout the, basically throughout the medication, because I didn't really think that I needed that much, I started going to the gym, and I felt better. And then, 20 years later, prior to founding Rewind, same thing. I was, overweight. I was depressed. And I thought about going to, doctor and getting some, Prozac, because I know a lot of people that are on Prozac. And I had a good friend that convinced me to go to an anti-aging clinic. Of course, then you learn that you're low in testosterone, and you do some research on the internet, and you realize that, depression can be driven by low hormone levels. Of course, I made some other changes in life, but 4 or 5 months later, I was a completely different person.
Yeah.
And then you realize, like, oh my God, there have to be millions of people that are out there like me that either don't want to talk about themselves being depressed, or B, have confided in a physician, and the physician, because they're taught, they don't know that there are other options, and write them a prescription, and then that person is on Prozac for life, and that there are a lot of negative side effects to going on some of these antidepressants.
Yeah. And it all started because you were overweight, you know? And even if you exercised, more, you probably wouldn't have lost all the weight. You would have felt better, know?
Exactly.
But like when you change your diet and you started exercising, and then you started doing hormones, people think, oh, if I'm going to exercise, I'm going to be healthier. If I'm going to eat better, I'm going to be healthy. It's not that, one doesn't, 1 + 1 doesn't equal 2. When it comes to your health, it's complicated. You have to do a lot of different things. You have to be happy. You have to be emotionally stable. You have to have to have your hormones under control. You have to eat well. You have to have good habits, I look young, for 49, and people tell me, oh my God, you don't change. What do you do? I'm like, dude, I do so many things.
Yeah,
exactly. We don't have time to talk about it. It's not like I do 100 things a day, but I do different things all the time. I went to the chiropractor yesterday. I don't even have a back problem. I was like, I've been to the chiropractor. I'm like, align my spine. Why not?
Exactly.
I'm gonna do a obstacle course race tomorrow because I don't know why. I'm like
convinced by like 12 years. I don't know how old they are.
9-year-olds.
Yeah, 9-year-olds.
2 9-year-olds to go do the obstacle course. So I'm like thinking, okay, I'm not 20. I need to get myself in shape. So today I worked out. I'm gonna stretch. I'm gonna stretch when I wake up in the morning. I'm gonna do stuff all the time to try to, stay healthy, maintain healthy, and thanks to you, you put me on my hormone replacement therapy, and, that was a game changer for sure.